and they don't see that it's okay not to be okay.
They protect communities across the country, but police say they're struggling to protect their own mental health. An alarming majority of police officers face alcohol abuse, depression, PTSD, and suicide. Officer Jim Banish says his life's work is to change that. He's peer support coordinator at the Warren County Sheriff's Office and founder of local nonprofit NYLEAP, which stands for New York Law Enforcement Assistance Program. This week, he's conducting training at the Saratoga County Sheriff's Office. His goal is to normalize police seeking help through peers.
Traditionally, there's been a stigma attached to an officer getting help, needing help, because officers will look at it and say, well, I'm not going to get promoted if I go and talk to a clinician. I'm not going to get the next best thing or whatever because they're going to see me as being weak.
And NYLEAP officers tell me that today more officers die by the hands of their own guns than by homicide.
We're killing ourselves at 2 and 3 times the rate that the bad guys are killing us. We see that there's an epidemic.
An epidemic that spread to Banish's own brother. In 2008, Lieutenant Joseph Banish took his life while he was still in uniform. The tragedy inspired Banish to create NYLEAP.
I'm very open about my story and what happened to me and how I got to where I am, and I share that as often as I can to empower others.
Today, the nonprofit has grown into a national hub for first responders' mental health care. The organization consults confidentially with officers across the state and the country.
It's not going to stop until I can bring those suicide numbers down to 0. So I've got my work cut out for me.
In Saratoga County, Noelle McLaren, News 10, ABC.